everyone, my name is Nandini. I am from CSC B section second year, and today my topic is patient-centered care model based on design thinking and innovation. First we are moving to the case study report on patient-centered care models. First we are moving to the introduction to the patient-centered care models. The introduction about patient-centered care models is patient-centered care is basically called as PCC, is an approach that places patients at the forefront of their healthcare journey. It emphasizes understanding the patient needs, preferences and values, ensuring that care decisions are made in partnership with them. As healthcare systems evolve, organizations are increasingly adopting innovative models like design thinking to improve patient experiences, enhance care outcomes, and streamline processes. Next, we are moving to the objectives of patient-centered care models. To review the key components of patient-centered care models, to analyze the effectiveness of patient-centered care on patient outcomes, to examine a case study where a patient-centered care model was implemented successfully, to explore the challenges and benefits of implementing patient-centered care in healthcare settings. Next, we are moving to the real-life case example by taking the design thinking process. Improving patient experience at a large hospital network hospital context. Basically, design thinking based on 5 steps. Those are empathize, define, ideate, prototype, test. A large urban hospital network in a major city recognized that although they provided high quality medical services, patient satisfaction levels were low. Patients expressed concerns about long wait times, feeling disconnected from their care team, and not being involved in decisions related to their treatment plans. The hospital decided to implement a patient-centered care model using design thinking to address these concerns by using empathize, define, ideate, prototype, test. And first we are moving to the step 1 of design thinking, that is empathize. The design thinking team conducted interviews and surveys with the patients, caregivers, nurses and doctors to understand pain points. The most common issues identified included long wait times, unclear communication, lack of patient engagement in care decisions, and feelings of being treated as numbers rather than individuals. And then next we are moving to the second step of design thinking, that is define stage. This defined team has a very important to access to care, continuity and transition, family and friends, physical comfort, emotional support, coordination, information and education, patient preferences. The design team defined the main problem as follows. The patients feel disconnected from their care team, leading to dissatisfaction and an impersonal experience. The goal was to create a system that improved communication, reduced wait times, and involved patients more actively in their healthcare decisions. And the third step is ideate. The team brainstormed several potential solutions, including implementing a mobile app for real-time communication between patients and healthcare teams, introducing patient navigator to help guide patients through the system, developing a welcome kit to help patients understand what to accept during their hospital stay, setting off touch points for patients to provide feedback on their care models. And next we are moving to the prototype. Prototype includes the creation of the mobile app, a digital care board that displayed patient information and progress, the role of patient navigator. The hospital developed a low-fidelity version of the app and pilot tested it with a small group of patients. In prototype, there are many members to treat a patient like surgeon, doctor, dentist, doctor utilization review, influencer, nurse, etc. And next we are moving to the test case. Feedback from the initial tests showed that the mobile app was very useful for communicating with healthcare providers and managing appointments. Patients felt more informed and in control. The use of patient navigators also reduced confusion and improved overall satisfaction with the process. However, the system still needed further refinement to optimize for scalability. And next we are moving to the outcomes and benefits of patient care models. improved patient communication, reduced wait times, enhanced patient satisfaction, empowerment and engagement. And next we are moving to the key points or key components of the patient-centered care models. Respect for patient preferences and values, collaboration and communication, comprehensive and coordinated care, patient education and information, physical comfort, emotional support, involvement of family and friends, access to care. And next we are moving to the technology and patient-centered care. Telemedicine. Virtual visits allow patients to access healthcare from their homes, improving convenience and accessibility, particularly for those with mobility issues or in rural areas. Mobile health, are also called mHealth. mHealth help allows patients to track their health status, medication, adherence, symptoms, and lifestyle changes. Patients can share this data with their respective healthcare providers, enabling better monitoring and personalized care. Patient portals. Many healthcare systems offer secure online patient portals where patients can access their medical records, schedule appointments, request prescription refills, and communicate with healthcare providers. And then the final important one is artificial intelligence and machine learning. AI technologies are increasingly being used in healthcare to predict patient outcomes, assistant diagnosing conditions, and a personalized treatment plans. And next we are moving to the conclusion of patient-centered care models. Integration design thinking into patient-centered care has transformed hospital networks by improving communication, reducing wait times, and enhancing overall patient experience. By empathizing with the patients and involving them in the care process, hospitals can align solutions with patient needs. This approach promotes more holistic, efficient, and compassionate healthcare delivery. And fine. Thank you, ma'am.